Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Sawa University Hospital, professor of medicine, University of Khartoum. We are still in our course, patient safety, based on multi-professional curriculum. This is topic 4. It's about being an effective team player. Learning objectives of this session: discuss the importance of teamwork in healthcare, recognize presence of different teams in healthcare delivery, implement a strategy on how to build effective teams, discuss barrier jeopardizing team function, recognize the role of the patient in healthcare teams. What is a team? Team is a group of 2 or more individuals who interact dynamically, interdependently. They have common goal or mission, have been assigned specific tasks, possess specialized and complementary skills, which mean that you have distinguished sets of 2 or more people who interact dynamically, interdependently, adaptively toward a common and valued goal, objectives, or mission, who have been assigned a specific role or function to perform, and they have a limited lifespan of membership. In healthcare, there are many types of teams. Could be single professional team or multi-professional. At the same time, could be located in a single or one location, or they go into different geographical area in the hospital. Some teams are transient team and some are long standing, so there are many combination of teams in healthcare. If we look at teams from different angle, we can classify them as core teams, coordinating teams, contingency team, ancillary, support, and administration teams. Core team is a team directly involved in patient care. Usually it is composed of a doctor and a nurse. It depends on the setting in the health delivery facility and the complexity. In many big hospitals, this team include pharmacist, physiotherapist, case manager, and assistant nurse. Coordinating team is the group responsible for day-to-day operation. This team coordinates functions and resources for the core healthcare delivery team. The composition of this team depends on the setting, but usually a nurse coordinates many of the activities. In some places there is a unit clerk that can schedule the radiology studies and lab studies, and in some facilities when it's an emergency activity, the doctor himself has to call and coordinate for a consult. Contingency team, and sometimes these are named as ad hoc team. Contingency team are formed for emergent or specific event, like rapid response team, cardiac arrest resuscitation team, trauma team, disaster team, obstetric emergency. The member of contingency team are drawn from variety of core teams. So these are functional team to address certain activity or task in the health system. Ancillary services or ancillary teams. Ancillary service team are primary service delivery teams whose mission is to support core team. It usually consists of individuals such as cleaners and domestic staff who provide direct, task-specific, time-limited care to the patient or support service that facilitate patient care, and they should know the goals of care. For example, if you have a surgical patient who should be NPO, and if you don't notify the nutritional service, then he might end up getting a tray and he will not be fasting for the procedure. Support service team consists primarily of service focused team whose mission is to create an efficient, safe, comfortable, and clean healthcare environment, which affect the patient care team, market perception, operational efficiency, and patient safety. Like those who are managing the supply chain, those who are maintaining the air conditioning and other logistic and environment in the hospital. Their function is very important to create the proper environment for healthcare delivery. Administration team, these are the governance for the facility. They set vision and mission, shape the climate and culture for the system, develop, implement and monitor policies. They set expectation for the staff. They determine the SOPs, role and responsibility and standard operation procedure, holding teams accountable for their performance and defining the culture of the organization. This team include the top management, executive leadership, unit manager. These should function 24-hour and are accountable for the overall function and management of the organization. Team steps, team strategies and tools to enhance performance and patient safety. This is an evidence-based teamwork system designed by U.S. Agency of Healthcare Research and Quality in collaboration with Department of Defense. It is mainly to improve communication, collaboration, patient safety in health care. When utilizing these strategy tools, we can reduce medical errors, improve patient outcome, enhance team performance in clinical setting, in the ward, in ICU, in the OR. It is especially useful for interprofessional teams. Team steps, as we mentioned, it is team strategies and tools to enhance performance and patient safety. To practice this, we have to have some competencies, including leadership, situation monitoring, mutual respect, and communication. For team leaderships, it depends on the ability of the team leaders to coordinate team activities, to clarify the role of each member, and to make all the team members aware about the team goals and mission, and to facilitate communication and promote mutual respect and how they can resolve conflict. Second competency is situation monitoring. You, as a team member and team leader, you have to have continuous awareness about the surrounding environment, about the team function, and about the changing patient function status, and how do these components interact with each other. Mutual support. Each team member has responsibility to improve team performance. Team members, they assist each other, they provide constructive feedback, they speak up to prevent error, and they speak up whenever there is a concern. Communication is integral part for team steps. Team member use structured communication, spark communication, call out, and iPass. We're going to have a full session about team communication. Team is a dynamic organism. Tuckman identified 4 stages of team formation and development. It goes through stage of forming a team, then they go through storming, norming, and performing. When we form a team, we need to select the appropriate members of the team, and we select the appropriate leadership. As the team members, they come from different backgrounds, and they go through stage of storming, and here there are a lot of conflict. If we have clear goals and mission and communication, then this can help to reduce the storming phase. Then when they understand each other and they understand the tasks they are performing, they go to norming, and this will lead definitely to performing. Most of the team are dismantled after a certain period of time. Teams represent a pragmatic way to improve patient care. Teams can improve care at the level of organization, at the level of the patient, improving patient outcome and safety for the team as a whole and for the individual members of the team. Successful team, they possess the following characteristics. They believe on a common goal, they believe on a common purpose, and they have a measurable goal. And at the same time, there is effective leadership that able to resolve and mitigate conflict. And they utilize structured communication, good communication tools. There is mutual respect and cohesion. They are aware about the situation. They have self-monitoring and flexibility, and they support each other. For teams to succeed, they need effective leadership. Effective team leaders coordinate and facilitate teamwork. First, they need to accept the role of leadership, and at the same time they need to know their limitation and call for help whenever needed. They need to set goals for the team and to set priorities and make appropriate decision at the appropriate time. They have to utilize the resources and to maximize team performance, and they have to balance workload within the team. They distribute the task according to the competency, and also at the same time they need to look at the learning, constantly monitor the situation and resolve team conflicts. Additional roles of team leadership: as we mentioned, effective team leaders, they need to coordinate and facilitate team work. They have to organize improvement activity and to build the capacity of their team member, and they need to know their training requirement. And they have to inspire the follower and maintain a positive group culture, to empower team member to speak freely whenever there is a concern or any question. And also they need to know when to delegate tasks and also to assign activity to their team member according to their competency. At the same time, there should be some communication strategy and when to use them, like briefing, debriefing, huddles, and the team should use structured communication during the sign off, and we'll have the detailed talk about this. Team communication is very important, like using spark communication, call out, check back, and hand off, and we have a complete session about structured team communication. Teams are subjected to some barriers and difficulties, and this could be related to changing roles of the team and even changing role of the team members. And medical hierarchy has an impact on the team performance. The individualistic nature of medicine plus instability nature of some teams. What we learn from other industries: failure in the team behavior have been identified as being responsible for accident in other industries. Roles not being clearly defined, team members, they don't know what's their role, lack of explicit coordination, especially when there are multiple teams, and the major part is miscommunication or even lack of communication. Assessing team performance. Assessing team performance can be carried out in workplace, in simulation environment, in simulation lab, through observing teamwork exercise. Team can be assessed by external expert or peer observation. Team can reflect on its performance when they do briefing, and after they finish the task they can do debriefing, so they can assess what went well and what need to be improved. In addition, they can conduct like structured feedback and feedback from member of other teams, and even also from the patient and their family. Take home: team does not just happen. Team is a dynamic creature. There are well documented team principles and performance indicators that can improve teamwork. Team communication is an integral component of successful teams.